Welcome back to McLaren Port Huron's Today's Health Program. Today we're talking about hip pain with Dr. Timothy Lukas. Dr. Lukas, how do you diagnose the cause of hip pain?
First step is come into the office and get evaluated. But there are several keys to getting the right diagnosis. One, coming in, discussing your condition and your case with someone like myself, an orthopedic surgeon, going through a thorough history. You know, was there a history of congenital or developmental problems with their hip? When did the pain start? When is the pain there? That thorough history is very key in terms of piecing things together. After that, then we go to the physical examination. What's the range of motion of that hip? Is there stiffness? Is there tightness? Are there pains at the end of range of motion? That's also very key and helpful in helping me determine what's the cause of the problem. Then I'll go to diagnostic tests, x-ray. So I'll pull up a diagram of a normal appearing hip. So again, the hip, the ball and socket portion, there's space in between the ball and the socket in this normal appearing hip, and that's the cartilage. And we get an indirect, sign of that or idea of that on x-ray. So I'll show you what an arthritic hip looks like. So again, here's the same ball and socket, and you notice there's no space left in between the two. So we know from this x-ray that they've got bone-on-bone wear and tear type of osteoarthritis. And I also look for other things, to make sure there's no lesions in the bone, none of those weird things we were talking about, avascular necrosis, bone tumors, those type of things. I always check for those as well. If I see a normal appearing hip x-ray and on examination I suspect there's still something going on with the joint itself, whether that's a cartilage tear, a labral tear, I might get an MRI to evaluate for those type of processes as well.
So the pain from the arthritis in the hip is caused by the bone-on-bone rubbing together?
Yeah, for the wear and tear type of arthritis, it's from the bone-on-bone.
After you diagnose the cause of the pain, what are the treatment options?
So like any other type of arthritis in the body, you have some very similar treatment options. Medications, anti-inflammatories versus analgesics. The downside to medications is over time there's some risk to your liver, risk to your kidneys if being on long-term prescription dose medications.
Are there any other non-surgical treatment options besides taking medications?
Yeah, there are other options. There are options like using a cane on the unaffected side to unload that hip, to try to take some of the stress and some of the pressure off that arthritic joint. Physical therapy in the early to moderate stages of arthritis can be helpful to increase flexibility, increase strength, try to get more life out of that joint. Injections tend not to be very effective for the hip joint for a number of reasons. One, it's a large joint. Two, it's a difficult joint to get into. There's a lot of muscles surrounding the hip joint, so actually getting the medication in the right spot is a difficult thing to do. And if we do that, a lot of times we'll do that in the operating room with x-ray there to make sure we localize it. But those injections tend to be temporary in terms of relief, unlike the knee, which can be quite effective.
So generally speaking, with hip pain, is it safe to say you start with some of the analgesics and the anti-inflammatories and use the assistive devices before moving to a surgical procedure?
Oh, most definitely. We don't want to start with surgery. We want to try to, again, prolong the life of what you have left. At the end of the arthritic process, when it's unbearable and we aren't making things better, then that's when we think about surgery.
This is great information. It's time for another break, and we'll continue in a moment.